Today's short video is about elders and cannabis use. I use the term elder rather than senior or boomer because, for me, the title of elder represents the wise elder of our human tribe. Indigenous peoples revere their elders for their knowledge, common sense, and their wisdom gathered over the years. Senior is overused and undervalued, and boomer has become a term of derision on social media. I'm very proud to be considered an elder in our society. Now I've cleared that up. Let's move on to cannabis use and elders. Why would an elder want to or need to use cannabis? Perhaps a family member or friend has mentioned their successes using it, or they read the recent ARP statement declaring their support of medical cannabis. If you are an elder, chances are you've heard of cannabis, i.e. marijuana, and may have even tried it when you were younger. You may even be using it now. A recent study in the Journal of the American Medical Association shows a significant increase in the numbers of people 65 and over who use cannabis. And older adults with diabetes, a chronic disease, had a 180% relative increase in use. People with one or less chronic diseases also had a very significant, nearly 96% increase in cannabis use. They also found an increase in cannabis use by alcohol-using older adults, a trend that needs watching and education about the harm that can come from using these two substances together. While the stigma around marijuana that was deliberately created in the early 1900s still remains, but is lessening, multiple cases of anecdotal evidence exist showing it is helpful for relieving insomnia, chronic pain, neuropathy, anxiety, and reducing the overuse of opioid medications and other painkillers, among many others. There are impairment risks associated with cannabis use in older adults, which are dependent upon dosing, which cannabis products are being taken, and how you take them. Some of these are dizziness, lightheadedness, and thinking or perception disorders. These can be avoided or relieved with education about dosages, methods of ingestion, and techniques for dampening the unwanted side effects, should they occur. Elders need to become educated about cannabis and find knowledgeable medical professionals who can assist them in their cannabis journey. We elders so often have several health conditions being treated with multiple drugs. It is very important for us to have sound medical advice about our medical cannabis use to avoid dangerous drug interactions. A particular concern are blood thinners and anti-seizure medications. Always inform your medical providers about your cannabis use so they can check for drug interactions, potential problems, etc. To help your healthcare provider understand more about medical cannabis, I've included a link to a healthcare provider information booklet in the blog located at www.cannabiscareteam.com/blog. Next time, I'll go over the different ways cannabis can be consumed. I'm Taru Fisher, an NLP health practitioner and NLP coach, and a healer-certified medical cannabis wellness advisor. Thanks for watching today. See you next time.